Good morning, Dr. Mark Fundino here with Davidson Chiropractic. Hope you're doing well on this Tuesday morning, July 9th. Today I wanted to discuss with you a little bit about disc bulges. Sometimes they'll be called disc herniations or a displaced disc or slip disc. But for the purpose of this conversation, we'll talk about the disc bulge, especially in the lumbar spine, in the low back. So I guess the first topic or discussion to talk about is what are some of the symptoms that either you or a loved one are experiencing or have experienced in the past? Well, number one, usually sitting is much more painful or much more uncomfortable than standing. Reason being, when you sit, you take the normal lumbar curve out of the spine and you put more pressure or more stress on the discs that are already been compromised or damaged. If you are sitting and you try to find comfort, usually I'll see patients kind of like lean back, their butts far away from the backrest, and they'll kind of be in this more extended position rather than sitting upright because they're trying to unload the discs. Number two, if a patient is sitting for any length of time, when they go to get up, they're going to find it very difficult to go from that sitting to standing position, because those discs have been compressed for that whatever length of time they were sitting. And then usually when they do get up, maybe out of the chair, and they're kind of in this bent over position, they have a hard time fully extending straight up and down. It can be pretty excruciating to get to that last little bit of range of motion into extension. Patients also tell me that first thing in the morning, it is so hard getting out of bed or taking those first few steps until things, quote, warm up. And what we can see is happening in reality is when you're laying flat on your back, actually water from your body's fluids is going into that disc. That disc gets its nutrition from diffusion, so the interstitial fluids of your body are kind of going into that disc since you're not bearing any weight. So when you first get up in the morning, whether you're sitting up or you go to stand up, your body's compressing all that fluid that has been diffused into that disc, and it may take minutes to hours before that pressure kind of balances out, especially with a disc that has these pain-sensitive fibers. It's not going to tolerate that very well in the beginning. So pain upon rising in the morning is a very common sign of disc bulges in this case. Also, either you or a loved one has had a history, or you're experiencing what we call antalgia, or a position of relief without even trying to do it, meaning we'll see a lot of patients will tell me, hey doc, when I look in the mirror, I'm all kind of, let's see if we can get this shifted off to the side, and this is their posture. And what's happening when that happens is that the body is trying to get away from the disc bulge. It's kind of trying to go to a position of relief. We call that actually a position of detriment, because ultimately we need to get you back to centralize over your pelvis and torso. But in the meantime, your body's trying to do what it thinks is right by shifting you away from the bulge or where that disc is most irritated. So that's another common sign and symptom. With that being said, what are some things you can do that can be... before we go to what you can do, another common thing that are people that have a more subtle disc problem is we'll see athletes will have a difficult time with spinal flexion. So if they're performing a squat with or without load, depending on the severity of the disc problem, when they get to the bottom of the squat, for example, as they lean down and their hips get below their knees or get into a deep squat, their pelvis kind of tucks underneath them, which is not bad in itself, but with the disc issue, it's going to cause more compression and more irritation to that disc that's already been compromised. Patients will also tell me when I perform repetitive wall balls, again, same mechanism, a lot of spinal flexion at the bottom of that movement. Also, same goes for deadlifting. when we deadlift from the ground, that last little bit of movement at the bottom is that spinal flexion. As we get the bar off the ground to about the knee level, we kind of can get back into that more neutral pelvic position, and usually is not much of a problem. Now, this is for people that have a less significant form of a disc bulge. Usually, if you're have a pretty significant disc bulge, you're not going to be doing any deadlifting or any squatting. You wouldn't be able to tolerate that. It's hard enough to do a normal task around the house, let alone doing some type of physical activity like exercise. So with that being said, those are some of the symptoms and kind of warning signs of what you might be experiencing with a disc bulge. What are some tips and tricks you can do at home to hopefully help your condition heal? So number one, sleep with a pillow between the knees or underneath the knees at night, just to keep your pelvis in a more neutral position. Everything, your thighs are lined up with your hips, your spine's in a good neutral position. This will make it a little bit more easier to get out of bed in the morning. So definitely use a pillow like a throw pillow, a couch pillow, something about yay thick that you can put between your knees if you're laying on your side. Number two, if you're sitting down, I encourage you to place that same throw pillow or couch pillow kind of between your shoulder blades, kind of like in the middle back between my shoulder blades. Reason being is if I don't have that pillow behind me, when I sit down, I'm going to collapse. And if I collapse in my middle back, I'm going to cause more flexion of the lumbar spine and irritate that disc. So if I can get that pillow between my shoulder blades and I can be more upright with my shoulders lined up with my hips, then there's a better chance that I'm not going to aggravate that disc as much. Take frequent breaks is another tip. After every 50 to 55 minutes, get up and walk around for 5 or 10 minutes. Being more upright and walking is going to put more pressure on the posterior elements of the spine, meaning more the facet joints and less on the disc. So if you have a true disc problem, you're going to notice that it'll be better to stand than it will be to sit. Let's see, what else we got? Oh, putting clothes on. That can be little things like putting clothes on or brushing your teeth can be real cumbersome because of the leaning over, the stooping over. If I want to put my pant leg on, usually most patients do it one leg at a time, standing on one leg. I'm going to encourage you to sit down upright, shimmy your pant legs or your pants over to about your knee height, and then stand up. Obviously, get the cuff so you're not stepping on the bottom of the pant leg. Otherwise, it's going to be hard to get your pants up to your waist. But shimmy the pants up while you're sitting, then stand up and lift the pants up to your waist, versus trying to flex over and thread those pant legs on while you're standing on one leg especially. Let's see, what else can we do to help minimize minimize the irritation to the disc? I want you to use ice. Ice can be helpful when in the acute phases in the first 48 to 72 hours. That can calm disc irritation and inflammation. So you can use a paper towel, then put the ice or the frozen bag of peas on the paper towel right around that lumbar spine, the lower back area. For 15 or 20 minutes, you can do that every couple hours, I would say. So hopefully you found some of these tips and tricks helpful for anybody that's having some low back problems such as a disc bulge, whether it be you or a loved one. Try these out. Also, please go to our website, www.davidsonchiro.com. If you scroll about halfway down the page, there are free tips, guides regarding low back pain, sciatica. We even have one on, I believe, shoulder pain and neck pain. So if you want some more information in kind of a ebook context, download those. And I look forward to speaking to you soon. Talk to you soon. Bye.